The next problem associated with our eyes and vision is a problem which you will have confirmed by visiting a doctor, and that's the problem associated with bleeding of the eye. In that particular scenario, there is a position to cut which is on the rear side of the head. Here we have a cup with the antiseptic cream. We've demonstrated this before in previous sessions. Putting the cup on initially allows us to mark the spot. As you can see there. So that is the key spot to actually cut the head if the patient is experiencing bleeding of the eye. And some of the symptoms associated with bleeding of the eye are, for example, headaches and a weak eye problem, etc. But this bleeding of the eye problem will only be confirmed through visiting a doctor. So you may be wondering, why are we actually cupping the rear side of the head when the problem is associated with the eyes, the vision of the particular patient? The rear side of the head is quite some distance away from the actual area which is distressing the patient. However, the way the actual body is created, if you like, the front portion of the brain affects the vision, the binocular vision fields, and the rear side of the head is the primary visual cortex. The primary visual cortex connects onto the optical tract and the optical nerve. So the rear side of the head is actually very significant as far as our visual abilities are concerned. That's why we cut the rear side. In terms of cupping this spot, our resident cupping expert will not actually cup himself because he doesn't have an eye issue of any sort. We just wanted to demonstrate the particular point that you would cup if you had a bleeding eye particular problem. Symmetry is also important, so if you're going to do one side of the body, you should often do the other side as well. So for example, if you've got headaches or an eye issue, in this case, it would make sense to do both sides. And the way the body is actually wired, the rear side, the left rear side of the brain affects the right vision, and conversely the right rear side of the brain affects the left vision. I wouldn't recommend patients actually cut this particular part of the body themselves. I would recommend they go to a professional to do this. This is quite a difficult spot to cut upon yourself, even for someone well acquainted with cupping spots and with many years of experience. However, our resident cupping expert is doing this to demonstrate to viewers how to do this and the fact that it can actually be done upon oneself. As you can see, the resident cupping expert, when he's cupping himself and patients, he's taking his time. He's very gradual. He's not cupping too quickly or excessively slowly, just very gradually. So the last thing you want to do is put a cup on and then apply excessive suction. That will cause you some pain. What you want to do is put the cup on and then gradually increase the sucking power.